So I finally leveled up on my channel, and I know what do you mean I've leveled up? I've improved the quality. Can't you see that the videos are actually looking much better now? I was actually having an experiment to see how exactly I would actually better my channel and actually make this a better experience for you guys in overall. So grab a piece of paper and let's go. Doc, when are you coming back to the department? I'll be coming, Doc. No problem. If you've never experienced such a scenario and you're in the third rotation or your fourth rotation, then nobody likes you. I can assure you that no one wants you in the department. Hello and welcome to Hospital Survival Guide. This is a series on my YouTube channel where we look at hospital-related topics, medical school-related topics, how to survive in the hospital, and how to make most of your medical internship. If you haven't yet subscribed to the channel, what are you waiting for? Hit the subscribe button as we are on the road to 10,000 subscribers. Do not forget to share the link to the channel to a friend and to tell a friend that we're now back on the channel and we're making more videos. Can I get a cheer, please? I know. Thank you. Anyways, so this is actually episode 3 of season 2, and I decided to actually put this video together because I was thinking on my way home from work, I was like, I really have slacked on my Hospital Survival Guide series. How can I actually revamp it? So I thought of this nice idea. Why don't I do 5 things that make you stand out during your medical internship? I know a lot of you guys are going to be either graduating, or a lot of you have actually graduated, about to write your licensure exams, and you are getting into that realm of internship, and now you're wondering, how exactly am I going to make the most of my medical internship? So lo and behold, this is a video of 5 things that will help you stand out during your medical internship. As you already know, when you complete medical school as a medical officer, you are actually obliged by government law to actually do what is known as internship. It's an apprenticeship. That's how medicine is. So now, this is going to be 1 year, 6 months if you're trained locally, or 2 years if you're actually trained outside the country. So if you're trained locally, the medical rotations, pediatrics and internal medicine are going to be for 3 months each, and the surgical rotations are 6 months. And then if you're trained outside the country, all the rotations, whether medical or surgical, are actually going to be 6 months in duration. So if you're actually preparing for internship and you're getting ready, these are 5 tips that actually you should go with as you start your medical internship. Beginning with number 1. So be organized. So what do I mean by be organized? There are a lot of things that actually happen in the hospital that you must be actually vigilant about. Number 1, in terms of your punctuality. So please make sure that you are always there on time. There's nothing that beats punctuality. I know if you may be late, maybe 1 or 2 days, don't make it a habit. Like, if you are chronically late, you're always late, find a way to adjust your timetable, because if you're always late, they'll always picture you as someone who is unreliable, because they kind of like correlate being early as being directly proportional to being reliable. So if you're always late, it means there's a high chance you're not reliable, because imagine it's a core day, and core day is beginning at 8. Your friends are in the emergency department and you're probably nowhere to be seen. It's overwhelmed with patients. The consultant is calling you, the registrars are calling you, and you're nowhere to be seen. So you're going to be deemed as someone who's not serious, someone who's always late for work, someone who's not enthusiastic about work. So that's the first thing under being organized. So actually be punctual at all times. The second thing is actually how you look, your outward appearance. Generally, I think this goes without saying that being a doctor is a noble career. It comes with prestige. It comes with certain things. It comes with certain respects. Now, if you're not presentable, you're looking like as if you are some hobo that they picked off from the streets and like, oh no, come, here's a lab coat. We need people to beef up the numbers. Come, you have dreads. It's okay, just tie them, come. So, if you are actually quite presentable, and you're always smartly dressed, you're always looking neat, then you're always going to be viewed as this person who is carrying themselves in a very good manner. So this is actually going to be having a positive effect on other people that you work with, a positive effect even on your consultant. This doesn't mean just look nice, also look nice and actually smell nice. Don't use strong perfumes. Like people that use pungent perfumes, you smell, they put on their perfumes, you can even smell them from the gate. You're like, this Dr. Nandi who has come has entered into the building, and you're able to smell them. You give patients asthmatic attacks. So that's the second thing. Please dress well and have this smart outward appearance. It will help you actually. And remember, when you actually get your logbook signed at the end of the rotation, there's actually a section for dress code. There's a section for punctuality. So in essence, this is all just about talking about the logbook. You can just simply say, refer to the internship logbook, because all these things are in the logbook. Then the third thing under organization is pretty much having your notes in a legible and in an organized manner. Sometimes they may be reading your notes and you may not even get time to interact with the consultant. You may not get time to interact with the senior registrars, but they will interact with you through your notes. You can tell how serious someone is by looking at their notes. Now you look at this person's notes and it's all over the place. There's a lot of scribbling, there's a lot of things that are missing, a lot of details that are missing, and you can tell that, okay, maybe this person's train of thought was all over the place. This person doesn't really know what they're doing. Of course, we know that doctors' handwritings are not the best in the world. That's kind of obvious, but at least do try. And remember that these medical documents are legal documents. So it means that in your particular notes, if you have written something that you know you haven't done, then it means that this is going to be a big problem for you, because if you're taken to court and they ask you, did you do this? Where's the evidence that you did this? If you've written it down and you didn't do it, it's an offense. You could possibly lose your license. You could possibly be blacklisted, because it means that you're not really an honest person and not someone who's carrying themselves with that nobility that the profession actually entails you to be carrying yourself with. So please be sure to write your notes in an organized manner. Be sure to actually write things that you have actually done. Never write anything that you haven't done. If you haven't done it, you can indicate. For example, if you're making a plan and you say maybe full blood count and you haven't collected the blood, you can say full blood count not collected and put a reason. Maybe the machine is down at that particular moment, because we know that machines actually, they run out of reagents in the lab. So please do indicate that the lab isn't working at the moment, or if a patient has sent you have written a request form to send to a private lab, please indicate that in your notes, that request form given to submit the sample to the private lab, such that if you were to be called and to stand in front of a jury or in front of a court, you'll be able to defend yourself. Your notes will be able to defend you, that okay, this person did indicate at this particular date and this particular time that the lab wasn't really running the samples. Then the other thing under being organized is, of course, having a manner in which you write your notes and having a manner in which you present patients. Because remember, medical internship is a way that we're going to be grooming each other to actually become better doctors. So you're under someone's tutelage, you're under someone's supervision. So they must be able to deem you safe and to have learned the important things that you really need to learn in that particular rotation. So it means that if your notes are actually in a very organized manner, it's going to help you, even your senior doctors and your consultants, actually, they'll be like, this guy is promising. They may even mistake you. Are you STP1? I'll be like, no, madam. I'm just in my second rotation. Then you're like, okay, he's showing some promising signs. So what do I mean by actually writing your notes in an organized manner? So there are certain ways in different other rotations. If you actually want me to do separate videos, or actually one whole long video on how to actually present patients and how to actually write notes for specific scenarios in each of the rotations from IMED, pediatrics, obs and gyn surgery, please comment in the section below that yes, please help us make a video on how you write notes for these specific rotations, such that we can actually make these notes. And we'll be right back after this message. So if you haven't yet subscribed to the channel at this particular moment, what are you waiting for? We're on a road to 10,000 subscribers, and we're very well. It's cruised. It's actually cruised. The number has cruised from the time we were 6,000. Actually, I remember when we had 3 subscribers on the channel, jumped to 18, jumped to 100 in like a day. Now we're almost close to 10,000 subscribers. If you haven't shared the link, guys, what's the problem, right? What's the problem? So please share the link. Let's get back to the video. Back to the being organized, of course, being able to write your notes in a proper manner. So if you're able to write your notes in a proper manner, it will mean that you understand what you're doing. There's a flow in which you're supposed to be following. For example, let's say you're dealing with a woman that is pregnant with severe preeclampsia. Of course, how I would want to articulate my notes, even if I'm not the first person that is seeing the patient, because if I'm the first person, that's a different thing. That now goes down to your history-taking skills and your ability to elicit a proper history from a patient to actually reach a diagnosis. But suppose now I am actually just taking a usual history for a patient that has already been seen, and I'm reviewing this patient after some time for maybe to start induction of labor or something else. There's certain important things that I want to actually include in my history. So this is how I always think about it. First of all, important things on your history, important positives and negatives. Second thing to include in your summary is, of course, what medication this patient is on, the dosage and the frequency. The third thing is what are the vitals of this patient. Then, of course, any labs that are ready or any imaging or any scans that have been done for this patient that are ready and the things that are pending and yet to be done. So suppose I'm looking at an SPE patient or a severe preeclampsia patient. I'll ask myself, okay, what's the gestational age of this patient? So she's a G2 para 1 at maybe 35 weeks by dates or 35 weeks by scan. Where was she referred from? Maybe she's referred from Kalingalinga, because they always send us SPE patients. So she's referred from Kalingalinga for SPE. The referral BP was this, the BP on admission was this, and the symptoms that this woman came in presenting with were this, the booking BP was that, and of course she's able to perceive fetal movements. And then, of course, the ranges of the BPs during this current admission have been this. The urine output has been this, maybe for the past per hour. And for the BPs, you can actually take them for the past 4 to 6 hours, because usually we want to monitor them every hourly. Then, of course, she's done some labs. The FBC is this. You record the results. The biochemistry are that. The scan shows this. If you've done an ECG, you even write your interpretation, meaning that you should have a proper understanding of how to interpret those results. Don't just order things like as if you are, if you are to actually look, actually say it in local language, you would say, ordering this like as if you're a mad person. Don't do those things. We don't do that here.
We don't do that here.
We don't do that here. So always make sure you order something that you know that is relevant. If you're ordering an ECG and you can't interpret an ECG, why are you ordering it in the first place, Mwewan? Do you want who to read it for you? Be able to read it. Of course, yeah, I have done an ECG video. If you actually want to check out the playlist, please head over I'm going to actually show on the screen here, actually. You can actually click there to actually go to the playlist and actually enjoy and learn about how to read the ECG. So please make sure that you write your notes in that particular manner. Even when you're presenting a patient and you're reading through, you're able to tell that, okay, this person has well prepared this patient and they have read everything. Even if you've forgotten something, you'll be forgiven. Now imagine you're disorganized, number one. You have missed out certain things on the history. You have made a big mistake, a big blunder on this patient. They will eat you alive. Then the other thing is, of course, knowing your patients. No one ever likes, consultants don't like, I'm presenting Madam. She's 23. Yeah, 23. Okay. She's 23 years old. She was referred from She was referred from consultants don't like that. So please make sure that you know all your patients, whether you have 50 patients, whether you have 20 patients. Worse off if you have just 2 patients or 5 patients, the consultant expects you to know these patients like as if your life depended upon it. So that's all part of being an organized person and being organized. So the second point of how to stand out during your medical internship is, of course, speak and carry yourself with confidence. No one likes someone who's not confident, because if you're not confident, you may even say something that's right, but no one will believe you. Like, I think maybe the risk factor for preeclampsia is being a prime gravida. Yeah, I think so. Even if you're right, we won't believe you because you're not confident. But if you're confident, I once met a student actually that was very confident. Funny story. That student was confident with the wrong answers. So don't get me wrong here. He was confident with the wrong answers. He would answer every single question wrongly, but with confidence. And actually, there's a nice psychological trick. If you want to get someone to teach you, actually respond to them. Maybe he was using that trick. Respond to them in a wrong answer. Then they'll be inclined to correct you, because human behavior just generally has this tendency to correct others and to correct their mistakes. So if you actually say something that's wrong, then they'll correct you and they'll teach you that. But of course, sometimes saying the wrong things, wrong things are very hard to forget. I don't know why the brain is like this. If someone tells you something that's totally wrong, you will remember it. But if someone tells you to correct that, it will be very difficult for you to unlearn that wrong thing. So I don't know how the mind works. It's actually a mysterious thing. So actually speak with confidence and carry yourself with confidence. Everyone likes a doctor that is confident. When you're talking to the patients and you're offering them treatment plans, they'll be able to tell that, okay, this guy really knows his stuff. Even when your colleagues actually call you in for a second opinion, actually talk to them with confidence and that you know your stuff and that you're not really, because people can tell. You can tell if someone is talking about something and they're not really so sure about it. But then again, don't get me wrong. Confidence does not mean the same thing as arrogance. Do not be arrogant. No one likes an arrogant person that thinks they know it all, thinks no one can advise them. No one actually likes to deal with such people. We generally want to avoid such people, because generally if they're arrogant, they'll always be constantly feeling like as if they are right, and we know that no one is ever right all the time. So please make sure that you carry yourself and you speak with confidence each and every single time. But this segues to my third point, meaning you should be able to accept your wrongs. You should be able to accept when you have been wronged. You should be able to accept when you're wrong, not accept when you've been wronged. Okay, even when you've been wronged, you should be able to accept. But you should be able to accept when you are wrong. You are in internship and you're about to make a lot of mistakes. There are times where I've seen patients and I've messed up, and I know that I've messed up and I've been wrong. I've gone to apologize to the seniors. I've apologized to the patient. There's some patients that we've messed up on, and the patients, if you know it, you sit the patient down and be like, okay, this is our fault. On that part, we deeply apologize. We hope to do better next time. Then, of course, you move on like that. If actually you're in the habit of accepting your wrongs and actually apologizing when you're supposed to apologize, people will actually want to work with you. It'll be much easier to work with you than someone who is never wrong. There are those people that will even argue with the boss, and I wish I had that confidence. If I had that confidence, I would definitely be driving a Hilux right now, because I would have convinced one of you guys to actually probably get me a Hilux. If there's a millionaire on the comment stream, you know what to do. Be forward, Hilux. Anyways, be confident and accept your wrongs when you are actually wrong. So that's point number 3, accepting your wrongs. And of course, there are sometimes you will be blamed for things that are not your fault. Of course, be able to defend yourself, but in a respectable manner. You'll be like, no, doc, but I actually did this. Here's the evidence on the file. Can we have a look at the file? Of course, there are those doctors that will instantly brush you off, and they're like the military type of arrangements where they just don't want to listen to anything. You're wrong, and that's it. Don't be one of those seniors. I know all of you are going to be seniors at one point. Please don't make such senior, because there was one time where I actually saw a post and a meme. I'll actually leave it right here. I saw a meme actually on an intern doctor actually slap senior doctor, and you actually understand. So actually, when you guys make seniors and later on in life, please make sure that you're kind to your juniors, and you also, as a senior, be able to accept when you are wrong. The fourth thing is actually asking for help. That's actually one of the biggest things that a lot of medical students, a lot of newly graduated doctors don't like doing, because they feel like if you ask for help, it takes away your degree. It makes you feel less of a doctor. But then I'll ask you this: if you ask me for help right now, are you going to get any less on your salary at the end of the month? No, you won't. Are you going to lose your MBCSP or MBBS? Will they subtract any points from your A+, your B+, or what? Nothing. You won't lose anything. Moreover, you are the person that's going to be gaining from this experience and actually asking these patients, actually asking the seniors. Because when you ask for help, it means you have acknowledged that you can't do this, and you have pretty much acknowledge that, okay, this is beyond me. I haven't dealt with such a case before. And if you haven't dealt with such a case before, you're able now to even work out and like, okay, fine, doc, I've been dealing with such a patient. What would you do in this case? It may not just be the doctors that are specifically from your unit. You can also ask for help from doctors from other units. So please be in a habit of asking for help. It doesn't take away anything. You can ask for help from your colleagues. You can ask for help from your seniors, from your consultant, from even the nurses on the wards, the pharmacists, even just someone who's just helping out with cleaning the wards. They can teach you something, because remember, in medicine, it's all about experience. They have been in the hospital longer than you have been there. So they may know some things, or they may know where to find certain things that you don't know because you're new to that environment. Then the fifth and final thing about how to stand out during a medical internship is actually knowing your stuff. I know, you'll be like, what? Isn't this internship? Aren't we supposed to learn during internship? When you're probably in school right now, like, I'll learn these things in internship. Oh, okay. Anyways, there are certain things that we do expect you guys to know when you graduate from your school. For example, you can't be a doctor and you have graduated and you have no idea which color bottle to use for specific tests. Something that's quite basic. And then if you've rotated during the ward, you should be able to know the specific color coding for the bottles. Of course, that doesn't take away anything. It doesn't mean that you're less of a doctor if you don't know this. And if you don't know this, please, you actually do get to know it, because we don't want to reach a scenario where you actually send the wrong sample container in the lab. If your lab is petty, those CTs send you back a printout. Please submit in the right bottle. They'll even put you for your comment and say purple bottle. So please be in the habit that you actually know your stuff. Remember that learning is constant in the medical field. It's something that you're going to be doing from the time you actually get into medical school until the day that you die. You will constantly be learning, because there are always things that are coming out. There's new researches that are being done, there are new treatment things that are coming out, new pathophysiologies that are being discovered. So please make sure that you're always in the habit of reading the latest information. You're always in the habit of learning the new things, because once you are in this particular habit and you keep learning, then you'll find out that you'll be able to become very knowledgeable at so many things, and you'll be a reliable person, and people will easily contact you. Just know that if you are in the department and your bosses have never called you to actually see a patient, or they haven't trusted you enough to see a patient, then know that you're probably wasting your time there, even if you're doing these other 4 points that I actually told you about. So please make sure that you do know your stuff. Continue reading, because it's a continuous professional development and continuous learning that you have to undergo. Remember, no one knows everything. Even I have a bunch of things that I have to learn. Even just after this video, I do actually have to do some studying and actually read on a few topics and refresh on a few topics. So remember that the learning never stops. There is no master at anything. And with that said, those are 5 things that actually make you stand out during your medical internship. And just to summarize, number 1, be organized. Number 2, speak and carry yourself with confidence. Number 3, accept your wrongs. Number 4, ask for help. And the 5th and final thing is to know your stuff. If you really enjoyed this video, consider subscribing to the channel. Hit the bell notification icon so you never miss such amazing content every time I post. My name is Dr. Moses Kazevu, to Zambia and beyond. Until next time, bye-bye.